First thing I'd like to submit for the record, Administration for Children and Families, OR Field Guidance Number 10 and Field Guidance Number 11.
Without objection.
Thank you. Last week I met with a young gal, 15 years old, who unfortunately let herself get tied up with what is quickly becoming the medical establishment. She had been on, I think, testosterone and puberty blockers, wound up getting her breasts cut off at age 15. Now she just feels horrible about that. To a degree, she feels she's made fundamental changes in her life, and she's never going to be able to live a normal life. I've also read a book, When Harry Became Sally, by a guy by the name of Ryan Anderson, which talks about the horrific long-term effects of these type of gender, what I guess you guys would refer to as gender-affirming healthcare. Mr. Secretary, what are puberty blockers?
I'm sorry, Congressman.
What are puberty blockers?
Congressman, there are a number of medical treatments and services that are provided to Americans to fulfill their health care needs.
Yeah, what effect do they have on brain development? Do we know that?
Well, based on the recommendations of a physician, an individual would be recommended for types of medicine.
Do we know, have we done like studies over a period of 20 or 30 years? So we know the long-term effects of puberty blockers on kids. Seems to me a very significant thing that I would never allow anybody who was asking for my advice ever to take. What is the long-term effect over 20 or 30 years?
Well, there is scientific and medical evidence with regard to the practice of some of these medicines. These are treatments and therapies.
Where's that evidence?
There are a number of medical journals that we could cite you to. There are a number of physicians who've been providing gender-affirming care for quite some time. Most every major national medical association supports gender-affirming care, and so it's not new. It's been around.
Isn't it true that on some of this stuff, Scandinavian countries, Dutch countries, at one time recommended this and they don't recommend it anymore?
I'm sorry, who did not?
Scandinavian countries and the Dutch.
Congressman, I could tell you about America. I'd be out of my lane if I tried to tell you about
Doesn't bother you that European countries at one time used these and now are backing off?
Yeah, I think we have some of the best medical professionals in the world. We do some of the best research. I trust the medical judgment of those who are experts in this field.
Okay, I guess I'd ask you to familiarize yourself with what's going on in other countries and see why they're backing off this sort of treatment. Next, are you familiar with studies that show, increased levels of suicide, depression going with people who take these puberty blockers, and much less people who have surgeries when they're 15 years old?
Congressman, we can talk about a lot of the research and the data. I will tell you that what we know at HHS is that many of the transgender youth that are having very difficult, traumatic times find that getting gender-affirming care has been helpful in stabilizing their lives.
You stand behind the idea of a 15-year-old girl having her organs removed. You think that is, under any circumstance, appropriate? 15?
Congressman, you're asking questions that are issues that are made or judgments that are made by that individual patient with that patient's physician, a medical expert,
She's
not a politician.
15. I know she's making the decision. She was 15. Doesn't that mean anything to you? You think this is appropriate for a 15-year-old?
It means a lot to me that a medical professional is the one guiding that patient's decisions, not a politician, not a bureaucrat.
Okay. Want to switch really quickly to ORR and the type of people who are becoming sponsors. Frequently these people are becoming sponsors, claim to be relatives of some nature. Do you ever do DNA tests on these people to assure that they're related if they claim they're related?
We do a number of background checks. We include fingerprinting.
You do DNA tests?
We do background checks, and we do them
the
way they
are. No?
That doesn't, I can tell you what we do.
Yeah, that's what I want to know. Do you do DNA tests?
We do background checks that include fingerprinting. We
It's
check.
just a yes or no question. Okay, I know that at the southern border, the Border Patrol does DNA tests sometimes, as somebody says. I gave you a yes or no question. You have the capability of doing DNA tests. Do you do them or not?
Mr. Grothman, I think the witness answered your question.
No, he didn't
Ms.
answer the
Well, he did.
question.
He didn't answer it, so he answered it. Ms. Wilson, you're recognized for